So conclusions would be as follows: that CELMoDs, in my opinion, through targeted protein degradation, have significantly improved activity and distinct properties that, in my view, set them apart from the immune modulators. There's more potent binding of cereblon and degradation of Ikaros and Aiolos. There's substantially greater myeloma activity, and in the preclinical setting, in IMiD-resistant models, this is particularly striking. And then I think what's so promising is the enhanced effects on the immune system. So this is a true immune adjuvant approach. Integration into relapse refractory therapy has been really dramatic. These are oral agents. They have real-world application. The phase 2 studies have been very promising, and the phase 3 trials look extremely exciting, with 2 out of the 3 now showing that they're meeting their primary endpoint very comfortably. And I think what's true about these drugs is that they're well tolerated, and I think with manageable toxicities and low rates of treatment-related mortality. So the real-world translation here, I think, is going to be very favorable. There's encouraging activity addressing an urgent unmet medical need in both triple-class refractory and BCMA refractory and/or exposed patients. It targets extramedullary disease, particularly with mezigdomide, and I think that's especially attractive. And then I think what's really interesting is the ability to combine these drugs with standard of care drugs, and most importantly, to look at novel approaches such as selinexor. Now, tazemetostat is very promising, but obviously with the recent data about second cancer risk from it, tazemetostat will probably be deprioritized. But I think with trametinib, we're seeing obviously great data there as well. As I mentioned, we've got really nice data with selinexor as well. And I think what's so promising about the CELMoDs is that they're going to be immune energizing and reactivating with CAR Ts and bispecifics. And I also think they'll have an important role with antibody drug conjugates. And so finally, as we move into the upfront space, ongoing phase 3 trials of iberdomide look really exciting. I think the promise of iberdomide being integrated to maintenance, but all those potential benefits, including less second cancer, are tremendously attractive.